Welcome everyone to the IWH Speaker Series. My name is Monique Chignac. I am the Scientific Director and a Senior Scientist at the Institute. Very happy to have so many of you join us today. Before I introduce our speakers and turn it over to them, I'd like to just go over a couple of housekeeping, how we'll run the session today. So first of all, if you are interested in closed captioning, you can find it at the bottom of your screen. It may be under the More symbol with the dots, and then you'll see a CC. What we'll do today is we tend to get a lot of questions. So we ask that you type your question into the question and answer box, the Q&A box, which again, you can find at the bottom of your screen. I'll try to get through as many of them as possible, but the speakers do encourage you to contact them directly if you don't get your question answered in the session. I'll try to bundle similar questions so we get as many answered as we can. So today I'm delighted to welcome two speakers, Dr. Basak Yanar and Dr. Cameron Mustard. Dr. Yanar is an associate scientist at the Institute for Work and Health. Her research interests include understanding the working conditions and health and safety needs of populations experiencing occupational health and safety vulnerabilities, such as immigrant and refugee workers, small businesses, and workers experiencing mental health challenges. And she's interested in the workplace practices and system supports that make injury prevention and return to work more equitable and accessible. Dr. Cameron Mustard, many of you know, he is the former president and senior scientist at the Institute for Work and Health. He retired after 20 years in the position back in January 2022. Cam continues his affiliation with the Institute, leading a number of active research projects, and his research interests include work environments, labor market experiences in health, the distributional equity of publicly funded health and healthcare programs in Canada, and the epidemiology of socioeconomic health inequalities across the human life course. And today they're going to talk about understanding small business motivations and needs, participation in the Health and Safety Excellence Program. Over to you both.
Thank you very much, Monique. Good morning, everyone. Cam and I are very pleased to be presenting our qualitative study on understanding small business motivations and needs, participation in the Health and Safety Excellence Program. First of all, I would like to acknowledge our IWH research team, as well as our collaborators and our funder, Ontario Ministry of Labour, Immigration Training and Skills Development. And I would like to mention that our study report is imminent, so it will be published on IWH website in the next month. So over to you, Cam.
So thank you, Basak. My role here this morning, I'm going to just provide a brief background for all of us about the WSIB Health and Safety Excellence Program. The program launched in late 2019, early 2020. And the program had the objective initially of enrolling a minimum of 4,000 Ontario employers to participate in the adoption of health and safety best practice elements that align to the ISO 45001 Occupational Health and Safety Management System. So participating employers in this program are supported by a network of qualified service delivery partners. And I think it's important to note that the WSIB program validates employers' implementation of the program elements. Financial incentives in this program are in the range of $120 million over 3 years that are available to participating employers. In the context of small business, I think the program was aware that as of January 2021, so this is the first year of implementation, about 30% of employers enrolled in the Health and Safety Excellence Program were smaller firms, less than 50 full-time equivalents. And I think that the program observed that the participation of smaller firms in the Health and Safety Excellence Program was substantially less than the approximately 85% of all firms registered with the WSIB who had 50 or less full-time equivalents. And I think it's important to note as well that while employees of smaller firms represent about 25% of the WSIB's covered workforce, unfortunately, half of traumatic fatalities and almost half of critical injuries occur in businesses that are small. So could I have the next slide, Basak? Okay, so I think it's also important to note in the early part of this decade that the Ministry of Labor, Immigration, Training, and Skills Development published the Occupational Health and Safety Strategy that includes an objective to provide affordable and convenient occupational health and safety resources for small businesses. So to align to the ministry's prevention strategy, the Health and Safety Excellence Program initiated a number of program adjustments aimed at increasing the participation of smaller employers and supporting sustained participation of smaller employers in the program. And just briefly, programmatically, the program introduced a selection of more basic topics in late 2021. Bolded here are leadership and commitment, health and safety responsibilities, and the importance of health and safety communication in the workplace. Financially, the participation fees to small businesses were either reduced or eliminated, and the financial incentives for successful participation for small businesses were increased. So it was in early 2020 that the ministry provided funding support to Basak and I at the Institute to conduct a qualitative study of the experiences of small businesses participating in the Health and Safety Excellence Program. So Basak, over to you to share a description of the objectives, methods, and the findings of the study.
Thank you. So the objectives of our research study was first to understand the needs, motivations, and experiences of small businesses that were participating in the Health and Safety Excellence Program's small business study, and ultimately to inform effective approaches to the delivery of occupational health and safety services to small businesses and ways to help them improve health and safety. So our study included interviews with small businesses, as well as service providers from 4 health and safety associations that were providing direct services to small businesses in the program. So our interviews with the small businesses included interviews with small business owners or senior leadership in the business, or occupational health and safety leads, or individuals with the administrative and operational responsibilities within a small business. But all participants were primarily responsible for overseeing the program implementation. And we have also interviewed service providers who were mostly occupational health and safety consultants who were providing direct services to small businesses, as well as a number of program administrators. And our interviews were in 2 phases. So this was a 2-year qualitative study. So our phase 1, our initial interviews were with the small businesses and the service providers around the early program enrollment. So it was in around the first 4 or 5 months of the small businesses when they enrolled the program. And then we did follow-ups approximately a year later to have a more wholesome understanding of their experiences in the program. So health and safety associations helped us with this recruiting the small businesses that were registered in the study. They shared the study information with the small businesses, and approximately we reached out to 180 small businesses initially, and we invited them to interviews. And our follow-ups were with the same small business contact who participated in our phase 1 interviews. And phase 1 interviews, the initial interviews, asked about the motivation to participate in the program, small businesses, occupational health and safety knowledge and practices and needs. And we also, talked about early experiences with program implementation. And follow-up interviews mainly focused on what happened in the small businesses after we first initially spoke with them. So we wanted to capture some of the improvements or changes to organizational policies and practices, as well as we talked about certain factors that impacted the program implementation, making health and safety improvements, such as certain facilitator or certain challenges that they have experienced. We conducted thematic analysis of the data of both phases of interviews. And just to mention that we adopted a qualitative exploratory approach. And our approach was mainly based on the key principles of a realistic evaluation framework, which basically meant that we were really interested in what worked for whom, just to understand the context of the small businesses and what really worked for them in the program, as well as making health and safety improvements. So in phase one, we conducted 32 interviews with 32 small businesses, 34 participants. In 2 instances, we actually spoke to 2 participants from the same business, and spoke to 12 health and safety consultants. And in our follow-up interviews, we were able to interview 15 of those 32 small businesses as a follow-up. And we have also spoken to 10 service providers. So just to give you a quick overview of the small businesses. So they came from different industries. We spoke to small businesses from construction, electrical, transportation, health and social services, retail, education, manufacturing to mining. And they varied in size. We spoke to businesses that were really small, to businesses with 50 employees. And some of them were new businesses, been around for 2 years, and some were really, older businesses who have been in operation for over 50 years. And 1/3 of them identified as a family business. And at phase one, out of the 32 businesses that we spoke to, approximately just under half were either in the very early stages of their topic implementation or had not started the topics at the time of the interviews, and 18 of them had progressed further in the program. So they were able to give us a little bit more understanding of what they were doing in terms of working through the implementation and changes to their health and safety. And in our follow-up interviews, we spoke to 15 small businesses. 12 of them had completed 1 or more topics, with 5 of them moving into year 2 in the program. And we were actually able to also speak to a few small businesses who had dropped out of the program and still wanted to share with us their experiences. So the first question or first thing that we talked about was what motivated small businesses to participate in and continue health and safety improvement program. So small business representatives mentioned that they wanted to participate in the program to first improve their health and safety policy and practices. So and wanted to access resources about health and safety. They mentioned that, they wanted to improve their health and safety procedures, wanted to ensure proper documentations were of their processes, as well as some participants mentioned that they saw the program as an avenue to increase their health and safety compliance and continue to sustain their business. And a small number of participants mentioned that improving their health and safety would help them to decrease workplace injury claims, which were costly for them. And a number of them also mentioned that they wanted to they aspired to for similar kind of health and safety practices that would meet the same standard as larger companies, and improve their business reputation and competitiveness. And especially this was true for certain small businesses who worked as a contractor, for example, for a large business, so that would improve their competitiveness. And of course, they talked about the financial incentives provided by the program as a motivator as well. But mainly the financial incentives went hand in hand with some of these other motivations. So for example, one participant mentioned, well, we have all the documents in place, but there's been no implementation or enforcement. There's been no health and safety committee. There's been no meetings, nothing. I just think that this is something that has to get done. I got an invitation to participate in the study, and I decided that, yes, this is something we have to do. In our phase 2 interviews and our follow-up interviews, small business participants mentioned that they continued to program. Well, one of them was because they were motivated by the financial incentives, as well as seeing now the tangible program impacts on occupational health and safety. So they talked about making these improvements, and they could see some of these impacts on their processes and procedures. So it motivated them to move forward and continue the program. And they also mentioned that this was an opportunity to receive feedback and improve their health and safety processes and practices. Also, a number of participants mentioned that they wanted to continue the program because they really wanted to see the long-term business benefits. So, for example, one participant mentioned, right now we are small. This is the time to implement this sort of thing. Then as the business grows, it's easier. People want to work for companies that are organized and that make everything very upfront and clear. I think for future employee retention, that's the key. And as I mentioned, there were a number of participants who mentioned that they dropped out of the program, but there were also a number of participants who have completed a number of topics but decided to discontinue the program. And this was mainly due to the challenges that they described as not having enough time, juggling multiple high priorities, and sometimes, there were administrative changes within the business and there weren't enough people to oversee some of these changes. And a very small number of participants mentioned, they couldn't fully understand the program requirement. There was a miscommunication. So they discontinued the program. And there was one participant who mentioned that the program really did not add much to their business because they already had the health and safety background and they were able to oversee these changes without the help of the program. However, one thing that we heard from businesses who discontinued the program, they remained committed to further developing or improving their health and safety programs. And they mentioned that they actually found the information and the resources shared in the program helpful. So even though they, for example, completed a topic and may not continue further, they said that the information and resources were really helpful and they would continue using these. So one participant mentioned, this was a participant with a health and safety background, saying that where I can see the program being very beneficial to somebody that really doesn't have the same background as me, that walks them through the whole process. I found it for my case to be just a little bit too much for what I needed to accomplish because of my background. It's nice to go through all the steps and get monitored feedback from the program on it. And we heard this from other businesses as well, as even though somebody had an occupational health and safety background, they found that the program really helped them, especially the resources, to get some feedback and formalize their procedures. So what kind of experiences did the small businesses have with implementing the program topics and making health and safety improvements? So our phase 1 interviews really focused on these early experiences in the program, and small businesses representatives talked about the program helping them to develop foundational health and safety knowledge, such as learning about leadership, commitment, and the roles and responsibilities within the business, and the foundational health and safety communication or certain reporting requirements, and so on. And mainly, the first initial experiences really helped them to recognize the gaps in their health and safety practices and also formalized health and safety policies. Our follow-up interviews, in our follow-up interviews, participants mentioned continuing their program implementation and health and safety improvements, especially around health and safety policies and practices. They gave examples of establishing formal hazard and incident reporting processes, establishing joint health and safety committees, or having a health and safety representative. Especially in our early interviews, we didn't hear much about the joint health and safety committees, but in our follow-up interviews, small businesses mentioned that they now have more of a functioning, established joint health and safety committee, and also providing formal health and safety training and providing health and safety resources for their employees. A number of small businesses representatives mentioned that they were now able to see more increased self-awareness, safety awareness, and engagement, especially from the supervisors or employees within their business. And they gave examples of, improved health and safety communication, especially, I think, through formalizing some of these reporting systems and procedures and trainings. So one small business, so this was this business in a construction industry. So one of the big things we implemented on site was having a health and safety box that has a binder. And the participant mentioned all the documents that this box had on site. Now the workers feel safe around site, and it's helpful for everyone to feel as a business we are working towards a safer workplace. I feel just changed the morale a little bit. Also, our interviews focused on in having conversations with the small business representatives about making health and safety improvements. We really were able to talk to them about certain factors that were instrumental in improving health and safety in their businesses, but also challenges as well. So we identify a number of factors, and I'll be talking about these in detail. First of all, I think approximately half of the businesses started the study, the program with limited health and safety knowledge and background. So having limited, so there were some, especially this was especially true for small business representatives who had more of an administrative role or an operational role within the business, but who now had to oversaw the implementation of the program. And for these participants especially, having limited health and safety knowledge resulted in a steep learning curve. So they talked about learning understanding the foundational occupational health and safety elements, understanding the roles and responsibilities. So that was like, a big learning curve for all of them. It was easier for small business representatives who had a health and safety role or a health and safety background to start with the program implementation. However, especially in our follow-up interviews, some small business representatives shared that being responsible for the implementation really helped them improve their personal knowledge of health and safety and their leadership abilities. So just to give you a few quotes from some of our participants that, this was really new for them. One participant mentioned that everything was way over my head because I knew nothing. And then there was another participant who were an owner of a business mentioning that the fact that you are the boss, but the reality is if you don't tell us, there's a good chance we don't know many of the regulations. It's not that we don't want to comply, it's that we don't know. And of course, we talked about small business resources, mainly limited time and limited human resources were important challenges for small businesses, having very limited time to dedicate to the program content. This was especially true for the representatives who were wearing different hats in their business. And the program participation was one more thing that they needed to do on top of their daily responsibilities. And also human resource challenges. Basically, participants shared that there weren't lack of qualified staff or sometimes high employee turnover increased the workload for the participants and often decreased the amount of time that they could dedicate into the program. And changes in human staff or having shortage of staff meant not having enough expertise in the company to oversee health and safety in the business. And they also talked about this kind of like needing to balance the time, staff, and financial resources to make health and safety improvements in terms of deciding who is going to oversee the training, who needs to be trained, and what kind of financial resources that they could balance in terms of making health and safety improvements. So for example, one participant mentioned, it sounds like the most obvious thing in the world, but the biggest challenge is time. Right now, another big challenge is staff. If there was training that was required in the past, I may have delegated that, but right now there's just not enough staff even to do the standard daily task required. So that was a pretty big challenge for small businesses. But they kept on working on the program implementation and tried to put in the time whenever they could. We also talked about the business and contractual structure. So participants talked about variability in staffing. So for example, seasonal work, or sometimes they had more contract employees and their staff number really shifted based on their seasonal work. So that impacted the health and safety communication or training that they needed to do, or even assigning joint health and safety committee members. But also small business representatives talked about certain small businesses. For example, they were covering a large geographical region, but most of their workers would be in remote work sites, or do lone work, which really impacted sometimes the health and safety communication, because sometimes the workers did actually not have access to email or other forms of communication. And also it was hard for some small businesses to bring people together to provide training. Also, they talked about certain contractual relationships, which meant different health and safety standards in client sites. So there were small businesses who sent their workers to clients' work sites, and that meant that sometimes they were not in control of what was going on in these different sites. And also sometimes, this could be a good thing because small businesses who worked for larger businesses were able to adopt some of the health and safety practices. But this could be a challenge because sometimes they really didn't have much of an authority in a client's site and what they did around health and safety. So for example, one participant mentioned, health and safety wise, I have very little control because they are going into the customer's area. The customer, they have the say of the working conditions, how they are set up, because we are for hire people. It sounds to me like our guys always wind up, if there's a really icky job, our guys do it. Also, participants talked about the work culture sometimes being a challenge to make health and safety improvements. They talked about this production-focused work culture, and sometimes which basically meant, some resistance to new information and formal procedures being introduced in the business. So for example, one participant mentioned, everyone is so busy all the time. There's a lot of apathy towards the requirements of health and safety. Every quarter when I set up the Joint Health and Safety Committee meeting, there's a lot of huffs and puffs about, I don't have time to be going to these meetings. They're not much for corporate procedures, I guess. And another important theme that emerged from our interviews were around leadership support and visibility. Although, of course, the senior leadership for almost all businesses were in favor, they supported the participation in the program, there was variance in terms of the support and the engagement from the leadership in terms of occupational health and safety improvements. So participants mentioned that when the leaders provided the representative with the resources, the time, and the authority to make changes, it really facilitated the implementation of these occupational health and safety improvements. And also participants talked about leaders being visible on the shop floor, being involved in the process and engaged. That really helped them. And then the other piece that was more around health and safety leadership, maybe health and safety personnel. So the representatives talked about when there was an engaged Joint Health and Safety Committee or a health and safety representative, or with supervisors who had health and safety responsibilities, and when they were engaged and supportive of these improvements that really facilitated the program implementation. In our follow-up interview, some small businesses representatives shared that actually the business leadership have become more visible and involved in the program implementation. And this could be because, some of the program topics really clarified the roles and the responsibilities, as well as really creates opportunities for the leadership to become more engaged. So for example, one participant mentioned, we have managers and supervisors, but the owner, the head honcho, I had him review the procedures to make sure they were up to snuff, and he read through them and would give me notes if need be. He was fairly involved, I would say. And finally, I think a very strong theme that emerged from our interviews were the support that the businesses received from the occupational health and safety consultants, as well as the resources provided by the health and safety associations or the consultants. So mainly this was instrumental support and motivational support. So resources and templates, especially policy templates, quick tip guides, and accessible videos provided by the health and safety associations were found to be really helpful by the small businesses. They were bite-sized, they were clear, and also especially with the policy templates, I think the businesses felt like they didn't have to start from scratch. They could use something that they could adapt to their business. And also, I think more importantly, the one-on-one support that they received in the form of a direct line of communication, health and safety consultant checking in, providing feedback, helping understanding the gaps, and providing kind of motivation when they felt like they weren't able to move forward, a consultant checking in and providing them with the motivation to, focus on a number of program topics were really helpful. So one participant mentioned, if I didn't have a person like the health and safety consultant, I would not get through the program and I would not have finished the policies. I can guarantee you that. Too much of life and too much of work gets in the way. To make sure that you just stay focused on just your area when project creep can happen so easily. And I don't know how many times consultant was like, okay, this is what we are working on. Let's bring it back to that. So in our interviews, in our study, we really wanted to set out to understand the needs and the motivations and experiences of the small businesses. And also we wanted to reflect on what we learned in terms of what could be really helpful for the small businesses in terms of strengthening their health and safety practices, but also moving towards a better health and safety culture. So, and we heard this from service providers who provided, direct support to small businesses and also small businesses themselves. Many small businesses have minimal health and safety knowledge and background. And I think an introductory orientation to health and safety and helping them to establish health and safety foundations is really important. Small business owners may not understand the regulatory environment, the provincial requirements, or the basics in health and safety. So I think it was really important to provide that kind of foundational knowledge was really important. And also small businesses make health and safety improvements in the context of limited resources. And as I mentioned, more of a complex and dynamic environment with staff shortages, variability in staffing and contractual structures. So I think they really appreciated the practical, simple, accessible, and resources that are relevant to their business. And having, templates and helpful, practical, simple tools that really help them, especially in the context of limited time and resources. And also small businesses may not be familiar with how to start the process of change within their businesses or plan for change, because we heard in reflection from small business participants mentioning that, they felt like they didn't provide enough time or they didn't account for the ebb and flow of how busy they were, ebb and flow of their business. So providing clear expectations around roles to help them understand the process and the time commitment to require making these health and safety changes would be really helpful. And also, I think supporting health and safety leadership, such as joint health and safety committees and health and safety reps, providing training to them might help build knowledge and confidence within the business that would be really helpful in terms of moving towards better health and safety practices. And I think direct one-on-one support was really helpful to small businesses to feel more resourced and prepared to make health and safety improvements. This was not just instrumental support in forms of like content and resources, but also motivational support as well. And I think having someone to call to talk to was really helpful to the small businesses. And I think small businesses really desire to establish a stronger safety culture within their business, but may experience challenges in terms of work culture, and perhaps leadership may not be very engaged. And I think orienting leadership, have an early focus on a safety culture while also establishing, the foundational health and safety elements perhaps would be really, really helpful. So there were a number of small study limitations we had. First of all, recruiting small businesses to do 2 interviews in a timeline of a year is really challenging. So challenges in recruiting resulted in smaller number of participants, especially in the year 2 of our study. So we could not capture the experiences of some small businesses who did not participate in the follow-up interviews. However, our sample included a full range of experiences and progress in the program. So we were able to speak to participants who were in the, still continuing the program, who moved on to year 2, completed, some of the foundational elements, and who dropped out of the program. So we were able to speak to businesses with who were in different parts of the program or different range of experiences. And I think that the strengths of our study included the amount of detail about the similarities and differences in the journeys of these small businesses that we were able to capture. And I think having a qualitative approach really helped us to capture that breadth and depth of the small businesses' experiences. So thank you.
Thank you very much, both of you, for a terrific presentation. Just want to remind everyone that we would love to have your questions. We don't have a lot of questions at the moment, so feel free to send questions and comments and type them into the question and answer box. Just to let you know, a recording will be made available of the presentation. So if you're interested in looking at it again or sharing it with someone else. So let me just start with one question. It sounds like there was a lot of positive response among your participants to the Excellence Program and to the involvement of the HSA consultants. Where there seemed to be challenges, they were mostly at the level of the organization in terms of awareness, time, and resources.
Yes.
That doesn't seem like something that necessarily WSIB and the HSAs can address. So were there any comments about how the program could be made more accessible, available, or increase the reach and uptake of it?
That's a great question. And yes, so one thing that was clear to us, and of course, the program maybe weren't a good fit for some of the small businesses, as I mentioned, who had, the background there. In terms of how to involve small businesses better, and I think I would like to give some examples from some of the things that we heard from the small business representatives. So one of the things that I think, this was a big undertaking for a lot of small businesses, but I think once they start seeing the content being really helpful and making small changes, they really felt like, for example, having a financial incentive was something that was a motivator. But I think seeing these changes and increasing the confidence, and also seeing that, there are helpful resources, was really helpful to them. So in terms of how to attract more small businesses, I remember actually speaking to a representative. I can't speak to in terms of the recruitment process or the processes that the WSIB would adopt, because I can only speak to the data, what we heard from the small businesses. But one participant, for example, mentioned that had I known that, because, and this was actually a representative who had no background in health and safety. It was a new business and they had to put in a lot of work, and it was very challenging for them. But they mentioned that had I known that, this is going to help me improve this much, I would have been a little bit more motivated to start, or I would still, kind of participate in the program.
Right.
So, in terms of, again, we weren't able to speak to small businesses who did not participate in the program and receive the same invitation. So we don't know why small businesses may or may not decide to participate or not, but we know some of the motivations of the ones that participated. But in terms of the processes around or how to attract more businesses, I don't think I can answer that in terms of what would be a good recruitment strategy.
Okay, thank you. Cam, did you want to add anything, or we have a few questions that have been coming in? Go ahead, Cam.
No, take it away, Monique.
Okay, a question thanking you for a really thorough presentation. How much time did the OHS consultant tend to commit to each small business? Did you get a sense of that?
Well, I think we did ask some of that question, but I think it really varies in terms of the, because I think different houses, I may not be actually the right person to speak about, on behalf of health and safety associations and individual consultants, how much time they spent on each small business. But we know that, we also interviewed service providers, and I think and it depends on the strategies of different health and safety associations in terms of how they, structure their relationship with the small business clients. But we know that from small businesses side also, what we heard is, they kind of got fairly regular check-ins from small business consultants, maybe weekly or monthly, depending on how they decide to communicate. But also at the same time, I think we heard from a number of small businesses that when they needed to ask a question, they could just email or call the health and safety consultant and they would get a response. It could vary, but I mean, I really can't speak to Health and Safety Association's own strategy around like, how much time they put
Okay.
in. Maybe there might be health and safety consultants or health and safety representatives in the call that might be able to speak to that, but yeah.
Okay. Another question. Did any psychological safety concerns or risks or injuries come up from the small business representatives, or did they focus more on the physical side?
I think mainly, so one of the things is in terms of making these changes, especially when we were talking about the program implementation, it was really more focused on, of course, the topics that they started implementing, right? So, and the foundational topics mainly focuses on, as like, the slide that we showed earlier, more injury reporting, hazard reporting, establishing policies and procedures. So a lot of those foundational pieces. So we did hear a lot of those, but we did also hear from small business representatives around psychological health and safety issues that they have experienced in their businesses, especially around we talked about it more in the work culture kind of pieces. So it did come up, but mainly when they talked about some of these improvements, it was really focusing on some of those foundational elements that really focuses on more of those policies and practices and creating the processes around reporting and all of that. But yes, there were some conversations around psychological safety as well.
Okay. Can you comment a little bit more? And maybe you can't, you may not have heard details.
Sure.
But you mentioned in your findings that there was a lack of uptake sometimes for a couple of reasons. One, that an organization didn't see value for their money. And wondering if you can comment a little bit more about why that was, what kind of maybe business it was, what was going on there. And then the second thing, that people may be shy to have outside eyes look at their health and safety status, and whether there was any more detail there that would help us know how to go forward with these kinds of comments. I do have a lot of other questions. We'll try to get as many of them as we can, but if you could comment on that, that would be great.
Yeah, and I think you related to the first point in terms of like, seeing no value of like, the effort put in for what you get. Yeah, I mean, there were a number of businesses who mentioned, small business representatives who mentioned that. So for example, one person said that, well, I really did not have time to put together an evidence story and then submit it because like what I was going to get back is not worth it, right? Or, they had other priorities and they had to put the program in the back burner because maybe the financial reward that they were going to get was really not, worth, the effort that they put in. So we did hear a number of participants mentioning that. However, again, I really want to mention this because this is what we also heard. They said, however, I really like the program content, but I still would like to I'm still using it. I'm still using the resources that were provided. So again, I think an individual business may make that kind of decision to maybe they felt like what they were getting back may not be, may not have that kind of a balance in terms of like, how much time that they would put in, especially if it's a really busy time or the owner is really overwhelmed. So we heard those kind of things. However, one thing that we heard is they said, oh, I would still use the resources and information to keep making changes. I think the second question is an interesting one in terms of feeling shy of, having someone else to look at it. We didn't hear that. But I think in terms of like, putting together their, when I say evidence stories, basically when you complete a program topic, the small businesses are asked to put together like, an evidence of like, what they have done. So providing some of the, copies of the processes or like, talk about how they made some of these changes. Not so much about shy, but I think we heard some mixed experiences around how hard or how challenging or easy putting those together, those packages were. I think it was more around, how much of a work it was or around that in terms of that. But I think health and safety consultants were really helpful in terms of orienting the small business representatives to maybe what to focus on in terms of putting together their packages. And we did hear, once, for example, WSIB reviewed it, they either received a rebate or not. But yeah, we didn't hear much about that kind of, not wanting someone else to look at their processes.
Okay, thank you. Could you tell us what the representation of immigrant workers was, or immigrant owners? Do you have a sense of that from your sample? The individual's wondering if you saw any differences in the care, health and safety care that was provided to these owners or businesses or workers.
That's a really good question, and I'm just thinking about the interviews that I did, we did have a small number of businesses, especially in kind of certain industries. I can think of a number of interviews that I have done where the business hired and employed immigrant workers. And we did have conversations around that in terms of, especially around occupational health and safety training, that they would provide to the workers. And we had some conversations around those. And then the other piece that the other conversation we had around immigrant workers were sometimes we spoke to small businesses in certain geographical regions where actually they weren't able to hire local staff and they were having staff shortages, and they tapped into immigrant workers. So those were a few businesses that we have spoken, but not the majority. Only a few businesses mentioned, hiring immigrant workers. And mainly we talked around, their needs around health and safety training and all of that.
If you could identify the one significant barrier that WSIB could help eliminate to increase participation, like staying in the program longer and implementing, what would it be?
Great question. I don't know if there's one, but maybe one with a little kind of like a few sub thoughts. I think one of the things that could be really helpful is really clearly communicating to the small businesses what this is about, what they are getting into, right? In terms of like, because I think some of those challenges that they mentioned, confusions about the rules, who is going to implement the program, or how long it is going to take. So maybe in terms of like, giving a really clear picture of what the program is about and what they are going to, what would be the benefits, and sometimes like, what would be the challenges. And I think giving that kind of a more of that kind of clear expectation would be really helpful. And then the other piece that we thought was, especially for small businesses who really did not have much of that health and safety background and knowledge, although program has a lot of foundational elements, we thought that like a really introductory module or something around really orienting the small businesses to the very basics of health and safety, and perhaps like, the occupational health and safety regulatory environment and requirements would really help them to maybe move into the program and start the program a little bit more of a stronger way than it is. So I think just like, clarifying expectations, setting expectations around the time requirements, because I think mainly those were a lot of like challenges in terms of that, and providing providing flexibility around the timelines. But again, I think, the most important piece was like this kind of direct help and resource whenever small businesses needed was really helpful. So maybe like, amplifying or emphasizing those.
Cam, I should ask you, do you have one thing you think the WSIB should change?
I think Basak's suggestions are good ones. I also think that the program, as it's evolved over the now almost 4 years, it's been available in the province, have been good adjustments, responding to recognition of some of the realities of the circumstances of small business. And as you said, Monique, your opening to the chat, the challenges are primarily internal. And that's not to be critical of small businesses, but the resource challenges, the human resource challenges, those are internal. And I don't think they're frankly modifiable in a meaningful way by the program delivery.
Okay, thank you. Someone has asked a question, just some context question, and I wonder if you can quickly kind of help us with this. Can you give us, what is a definition of a small business? What counts as small, and how many of them are there in Ontario? Is this most of the businesses or some? Can you just give us a little bit of context?
All right, so great question. And the definitional piece I think is important. About 80% of the businesses registered for coverage with the WSIB are less than 50. I think there's good reason to think about a size 100 employees or less as being somewhere between medium and small. Above 100, typically an organization has sufficient resources to begin to self-direct their health and safety policies and programs. And at the smaller end of the size distribution, the micro-size firms, less than 10, less than 5 employees. I can't give you an accurate number, but let's just say there are many, many, many organizations, workplaces, firms that are that small, ranging from relatively low-risk environments like a dental office to environments where there's a lot more exposure to hazards. So I'm thinking about the summer landscaping industry. So all by way of saying it's extremely varied and heterogeneous. And Basak, I might ask you the question, would our study have been informative in a different way if we'd selected a sector to focus on?
That's a really good question, because I think, and as I mentioned, we did speak to businesses from a number of different sectors. So I think in terms of, those internal challenges that we talked about, small businesses challenges, I'm not quite, I don't think that would vary that much, because across the board, despite, we spoke to small businesses from different industries, those challenges were very similar across
so
industries.
Yep.
However, maybe one thing that would be, maybe certain industries or certain sectors might have more requirements, not in terms of regulatory requirements that they need to adhere to. So for example, there was a small business where they had to, they were overseen by Ministry of Health, and the number of those, which may be a little bit more, there might be a little bit more regulations that kind of push them to have more formalized policies and procedures to begin with, as opposed to certain sectors. Maybe those kind of external requirements may differ. But in terms of internal challenges, we heard very similar things.
Yeah, thank you.
I just want to say to the audience, unfortunately, I won't be able to ask all the questions and give you answers today. I hope you will reach out to the speakers, but let's see if we can get another one or two questions. I'm going to bundle something together. Somebody has noted, again, you had quite a few dropouts for the phase 2, fewer than 50% of people. But we also have people who are interested, and that's a concern. We also had interest from members of the audience in whether you will be doing any follow-up research, either with this group or with a new study, and whether that's possible. Can you comment on that?
Is there a question around the dropouts, or is it just the question?
They're concerned, and do you know why that happened? How could you change that? And then can you do you have plans for follow-up? And again, how would that work if you're getting so many dropouts?
Right. So I think in terms of, it is a challenge to recruit employers in general to commit to, 2 interviews and doing a year of follow-up. So, and small businesses, for example, we actually, when I followed up with the small businesses that we initially interviewed, there were a number of them who got back to me and said, this is a very busy time. I'm really busy. It's, could be seasonal reasons or certain things, which really speaks to their challenge in terms of, committing time to anything. So that was number one. The other reasons why there was a drop, there were also dropouts. A number of businesses, actually, there were some administrative changes. The person who we initially spoke to left their role, and there was no one to replace or have an interview with us. So again, as you can see, sometimes there are these changes or busy, so we weren't able to follow up with certain businesses. So that's that's one of the reasons. However, I think also we were able to though capture perhaps like, maybe 1/3 of the businesses that were in the program. So actually we were able to have a good number in terms of a qualitative sample. In terms of the other question, this was about the
Are there
next
plans
steps.
to do additional research with different groups of small businesses?
Well, I mean, so currently that we concluded the study. However, Cam and I always talk about small businesses and, we discuss certain ideas and, thoughts around that. But we do not have any new projects at the moment. Yeah.
All right. Another question here. You mentioned at the outset that you had businesses that were quite new. They had just started up very recently and some that were older. Did you see any differences in the themes that were coming up across the tenure of the business?
That's a really good question. So, yeah, like we did speak to businesses who were just starting, and I think it is interesting because again, this is a really diverse group of businesses in terms of, there's the size, there's the years in business and all of that. I can't say that like, there were clear differences because, for example, we spoke to some small businesses that have been around for a long time, but actually they did not have formal policies or procedures in place, just like a new business didn't. So it really depends on the kind of health and safety and maturity of the business, not so much about like, how long they've been around for. And of course, so I guess like, we spoke to some new businesses, that really appreciated starting like, there are policies and procedures and all of that. Again, even, when a business was around for a long time, that didn't necessarily mean that they had policies and formal policies and programs in place. They knew how to do the work and like, they knew how to keep themselves safe, I think, because of that kind of an experience, but not so much in terms of like, health and safety processes. This is not true for, all of them, but I guess what I'm trying to say is, although there are big differences in terms of how long these businesses have been in place, that didn't necessarily mean that like, they had formal policies and procedures.
Okay. Unfortunately, I think we're going to have to end the presentation. I want to thank you for your great presentation. Lots of really complimentary comments from people who are in the audience. I want to let everyone know in the audience, although we weren't able to get to everybody's questions, we will give all the questions to the speakers so that they can maybe reach out, or you can reach out to them to learn more about the study. I want to thank everyone for attending today and hope you will join us for future speaker series at the IWH. Please do sign up for IWH news to learn more about those opportunities. And again, thank you so much, both of you, for a really engaging and interesting presentation today. Thank you, everybody. Have a great day.
Thank you.